Hey there, Toby Stark, Stark Associates Insurance Agency. Hot off the press, the 2026 Medicare Part D out-of-pocket costs. People still talk about the donut hole and the coverage gap. That's gone. I still hear it even 2 years after it's been eliminated. Don't forget to like and subscribe on my YouTube channel. We'd love to have you with lots of informative information in regards to Medicare, so please join the community. We appreciate it. So getting into it, this is the NABIP, or National Association of Benefit Insurance Professionals, and I just want to give a shout out to them. I am part of that organization, and what we do is we represent our Medicare beneficiaries on Capitol Hill, talking to our legislators about changes that need to be made that either beneficiaries don't know about or they're unhappy about. So we're always leading the charge there to help you. So in 2026, you have a deductible stage of $615. And what's a deductible? That is the amount of money that you're going to have to pay first before the insurance plan, in this case, the standalone drug plan, Medicare Part D, pays. Last year, it was about $590, depending upon the plan you enrolled in. Some plans had lower deductibles and some had none at all. So you're responsible for 100% of the prescription drug cost until your deductible is met. And people get confused and go, oh my God, it's so high. A lot of you aren't even going to meet it because you're on low-cost maintenance medication drugs that cost $2 to $3 per fill. So it's a good thing if you don't meet it. So initial coverage, $2,100. You paid 25% of coinsurance for your medication covered under your plan's formulary until the maximum out-of-pocket of $2,100. So you're going to pay 25%. And the insurance carrier is going to pay 75% until you hit $2,100, which is your maximum out of pocket. Such a win. Historically, Medicare Part D did not have a maximum out of pocket, and you would have to pay a small percentage if you hit the catastrophic this until the end of the year, and then it all reset. But now you have a cap or catastrophic coverage. Once you've incurred the maximum out of pocket of $2,100, your coverage does not end, and all medications on the formulary from this point forward will be covered 100%. This is fantastic news. Again, 5% of the Medicare population gets to this point, but everybody I talk to thinks it's going to be them. But it's important that you know these steps. And then the plan year restarts every January. So in review, in January of 2026, you start with a $615 deductible. Then once you surpass that, you will pay 25% up to $2,100. Once you hit that, you will not have to pay out of pocket for the rest of the year, depending upon how fast you get there. So last year, the maximum out of pocket was $2,000, and they bumped it up $100 for 2026. So it is that simple. And I know I say that tongue in cheek because when you get to the pharmacy and the transactions happen, sometimes it gets complicated. But this is how the breakdown of the 2026 coverage works in under 5 minutes. If you have any questions or you have a comment, please write down below or send me an email. Happy to help. Toby Stark, Stark Associates Insurance Agency, bringing clarity to Medicare and eradicating Medicare illiteracy.